Hi, my name is Mario Bizzini and I work as a research associate for FMARC, the FIFA Medical Assessment and Research Center at the Schultes Clinic, Zurich, Switzerland. In this section, we'll focus on the referees, an often neglected group in the world of football. First, we'll discuss some unique characteristics of these athletes, including physiological match and training demands, an area where several studies have been published, but of course not at the same amount as in players. FMARC has conducted several research projects in the areas of the PCMA and injuries in both male and female referees. This has also led to the development and later promotion and dissemination of the FIFA 11 Plus referee. Some number first, just to understand the proportion of referees versus football players. Based on the FIFA Big Count 2006, it was documented that there were more than 900,000 referees at any level worldwide. Today, the estimation is that there are far more than 1 million match officials, 90% being men and 10% women, which represent about the same percentage as documented in football players. Coming to the international referees, those wearing the FIFA badge, which allows them to officiate international matches and the World Cup, then we see that there is a small percentage. So at the end of August 2015, there were a bit more than 3,000 registered male and female international referees. Please consider some unique characteristics of the referees. Classically on the pitch we have one referee, two assistant referees, and of course the fourth official. No match will be possible without match officials. The career, internationally seen, can go until 45 years of age, and in some countries up to 50 years of age, depending if they pass some specific tests. On average, international referees are 10 to 15 years older than players, which has important implication in terms of fitness levels. They are rarely full-time professionals. This, on the other side, has implication in terms of time for preparation and recovery, as an example. Physiological demands of referees and assistant referees. During matches, they experienced high physiological and cognitive loads. International referees have similar match demands than midfield players. It has been documented that a referee may cover up to 13 km per match, which includes walking, running, progression running, changing direction, backwards running, and so forth, while an assistant referee covers up to 5 to 6 km per match, mostly lateral shuffling and sprinting. During a match, a referee has to take several decisions concerning fouls, offside, players' conduct, fair play, and so forth. And it has been documented that during international matches, referees can take up to 130 decisions per match. So all these figures illustrates well how modern referees imply specific training, both for the referee and for the assistant referee, in order to cope with the speed and intensity of modern football. Nutrition and hydration for referees and assistant referees. It is of course very important that referees and assistant referees have an healthy lifestyle, also because of their long careers. So there is not much literature on these topics. So the guidelines are typically available for players. As an example, you have the FMARC nutrition booklet, and there are some adaptations for match officials. So here it's an area of ongoing research, and hopefully we will have some work published in the next years. pre-competition medical assessments or medical screenings in referees. This is historically a hidden topic in refereeing because of several differences between countries, member associations, and cultures. So as an example, even at international level, referees were asked to bring a medical document just stating that they were healthy and physically fit to officiate matches. FMARC dedicated several studies to this topic and conducted detailed PCMA in the men's and women's selections for the 2010 and 2011 World Cups. All these materials has been also published. And since then, a PCMA with basic cardiac screening is mandatory for all referees participating at all tournaments or events at FIFA level. In this population, where we have, especially in the males, an average age higher than 35 years of age, an exercise ECG is also to consider due to the cardiac risk factors. Injuries in referees and assistant referees. FMARC has conducted several studies in this area. Of course, when compared to players, they cannot experience contact injuries, but they are exposed to a certain risk of injury or overuse problems due to their physiological training and match demands and of the long career. So concerning non-contact injuries, the studies have shown that there is kind of a similar risk for acute injuries than players, with a lower incidence though, and the top three injuries are hamstring strains, calf strains, and ankle sprains. There is also a certain difference between referee and assistant referees, with the latter having more adductor of growing problems, as an example, due to their activity profile. But moreover, overuse injuries are a major concern, this especially because of the long career. So here the top three areas are the lower back, then typically the calf muscle and the Achilles tendon, and also the hamstring muscles. Injury prevention in match officials. FMARC has worked since 2003 on injury prevention programs, the 11, then moreover the 11 plus, with several studies at different levels, injury prevention, performance enhancement. And of course, this represents an excellent basis also for potential intervention in referees. So following the injury studies, FMARC continued its cooperation with the FIFA refereeing department, and some basic programs were pilot tested with the FIFA male and female referee selection at all FIFA training camps and tournaments since 2008. So the FIFA 11 Plus referee was then developed in 2012 and launched in 2014 together with the Italian Referee Association. So the idea was to have a basic injury prevention program for referees and assistant referees in the same philosophy of the original FIFA 11 Plus. FIFA 11 Plus referee. The program is similar than the original FIFA 11 Plus. It has been studied and developed as a warm-up. It entails three parts: part 1 running drills, part 2 exercises, part 3 running drills, with the goal to optimally prepare the match official for the match and or training, and of course to have preventive effects on injuries and overuse problems. It includes specific drills or exercises both for the referees and assistant referees. In this program, you will find the related material of the FIFA 11 Plus referee. In this section, we had a closer look on the referees. The match demands of modern football are high, and therefore the specific preparation by the officials is crucial. They should be considered athletes, and therefore they deserve the best possible medical care. Areas as PCMA and injury prevention should be a mandatory part in the management of referees and assistant referees worldwide.